Thank you, Dr. Gersovich. We have much more to come from him. We have one more speaker, and then we'll take a little break. Our next speaker is Dr. Ron Jones. And Dr. Jones served as the Program Director for Transitional Year Medicine and Associate Program Director of the Summa Health System's Internal Medicine Residencies until 2023. He continues as a clinical professor of internal medicine, also at Northeast Ohio Medical University. And he has interest in professional formation and institutional wellness culture. And I'm so pleased today that he is going to be speaking to us about life before death. Please welcome Ron Jones.
Slides look a little funky, but that's okay. Good morning. Really glad to be here. For some of you who are like in the middle of or moving toward the end of your career in medicine, I'm sort of here to remind you that God's got more. Okay. So what happened to me after I actually completed 44 years of practice at Summa, and then transitioned 2 years ago, immediately had 4 other jobs that were going on. And each of them, I put those before the Lord. I'm apprenticed to Christ. That's really why I'm in medicine. I went into medicine to bring Christ with me wherever I went. And so God gave so many opportunities as a resident program director, as a person in practice in multiple occasions, and finally joining a national group that wrote curriculum for all residents in internal medicine for over 10 years. And during that time, I saw just what an amazing ability we have to bring into any practice setting, the beauty of who Jesus is and how he alters our care for our patients, and that's still going on. So when I got close to this transition, I guess if Joe were here, I'd call it advancement rather than retirement, right, Joe? So that's basically what was happening. I saw a new facility building in our community, and that facility was going to take care of homeless people who are actively dying. And I was approached by people there because I have covered palliative care and I've also done hospice medicine as well. I'm not an expert in either field, but I actually wanted to participate in this endeavor. And so Grace House, I'll tell you a little more about in a moment. Just a little bit about me. I don't know whether these slides are going to translate. That's fine if they don't. Maybe that's a little bit about me. This is my wife, Lynn, secret to my success, basically. And she also volunteers at Grace House as well, and is a volunteer caregiver and vigil person there as well. And I want to say just about CMDA. CMDA is an enormous part of my wellness and my ability to do what I do. I was mentored by CMDA when I was a medical student at Toledo. And there were people there that saw and understood our fellowship of just a group of medical students who were trying to figure it all out. And that became a key part, almost like a para-education for me throughout my entire career. And at every point, this fellowship here, and members of this fellowship, you know who you are, were mentors to me as well, and now I'm able to mentor other people. So this is an important fellowship that God brings alongside your practice, throughout your practice, and continues to give you wisdom, understanding of what you should be doing in this next phase. So the only thing I want to say about this is just it's great to be involved in the community. And so let me tell you a little bit about Grace House. So Grace House is a 2.5-year-old organization, freestanding. It's secular. So like you, I'm working in a secular environment and bringing what I have to bring spiritually into that environment. Grace House is part of a community-based palliative care movement that's happening that allows patients who are on the street, who would have no place to live at all. We go to Tent City. We do get referrals from hospice people who have nowhere to live at the end of their life, and they're going to get their hospice care and palliative care. This place is an independent, freestanding 6-bed or 6-room facility with a full kitchen, has a garden, has many other things happening there. So I was really intrigued by this, and I really felt God sort of giving me the green light to sort of volunteer at this place. There are 200 volunteers that come there from the community, so it's really certainly, it's certainly caught the imagination of our community. But the real work here is in connecting with patients who find themselves in this situation. Now, interestingly, and compared to this last talk we heard, we've had a 32-year-old who's dying of colon cancer. So we have people who literally are on ADHD medication, others who are in substance abuse, who come to us from the street, you can imagine, that really need addressed. There's active substance abuse, so we've partnered with Access, Health in Akron to be able to bring those facilities to us. We've had people in active schizophrenic dissociation. I mean, you can imagine on the street. And more commonly, we have people who are really at a great distance from their family. They've like lived their whole life without their family. And so suddenly now that family's coming to our institution, and that's been an amazing experience. So what I want to do in my next few minutes, I mean, we could talk about, and I hope in questions and answers we will, about the ethical considerations at the end of life that we face in these clinics. But I want to basically, in this room, every one of you guys are taking care of people who you cannot completely cure their illness. You cannot completely promise them with certainty how they're going to respond to treatment. And many of us are treating people, I've done it through my entire career, who are now dying, either actively dying or in the early stage of dying. And I found as Christians, we don't really receive specific training in how to connect with these folks. But I'm going to give you what I've been learning in these last 2 years, and also a little bit of evidence that's been underneath that learning. I am developing a curriculum for spiritual care for the nurses, but also for the medical students and residents who we are seeing at Grace House as well. So I'm going to give you today just 4 surprises that I've had working in this environment. So I'm going to take you with me into Grace House and share with you what's happening there. And these 4 surprises will give you sort of a pathway for your own development of the ability to connect with people who are dying in your practice. So the first surprise is it's not all pain and sadness. That's the first surprise. And this isn't the evidence-based one, but I just wanted to share with you transparently what I experienced when I went there. I thought, well, these people are actually facing their death, they're dying, it's gonna be a glum place, a gloomy place. And this is when I really experienced what's happening in new palliative care. What's happening in new palliative care, a place like Grace House creates a place where patients can continue to experience the things that gave them significance and meaning earlier in their life. So Grace House is interesting. There's a live band on Friday nights, missing the instrument that one of our 6 residents can play. Okay? There's a garden where people are planting for the next season. These people may not live to see it, but they're so excited about gardening because they've always been gardeners. There's a full kitchen where we have a couple of chefs right now who are in the last stage of the illness, but they will create meals for the entire house. And then we have people like Timothy, who's a body finish specialist for cars, but has an amazing command of history. So this guy is like just a rough guy, chain smoking guy, and he's in there with lung cancer, and he's losing weight, but he's still pretty vigorous. So when we found out that Timothy can speak on extemporaneously, like college lectures, on so many aspects of history, we began to schedule him. So on Friday at noon, we have lunch, and then we have a standing room only crowd that comes to hear Timothy. And I gotta tell you, I've sat under his teaching and listened to him, and he will talk about US presidents or the House of Tudor in England or assassinations. And honestly, he speaks without notes, completely researched and annotated in background of everything he says, and it's standing room only. I've gotten more out of his lectures than I have at many that I paid for back in college. To tell you the truth. It's amazing. And Timothy just sort of smiles when he realizes that he has a gift that he can keep using even in this stage. So what I'm describing to you, I mean, there are poetry nights, there's all kinds of things. There's a food truck, there's ice cream. So the first thing I learned in this setting is really good community-based palliative care places allow people to continue to explore what they're good at in this stage. The idea is you don't come there to die, you come there to live. And that's why my talk is called Life Before Death. Now there's another meaning to that, because as Christians, we are bringing our life with us every time we go to a place like Grace House. Every time we come to your exam room 9 when you've got someone who's been given a hard diagnosis. So now you're bringing Christ in that room, the fruit of the Spirit in that room, and now you're going to be doing something special with them as well. So I want to focus a little more of that on that process. By the way, all these are interesting people, all people at Grace House. We do take care of your comfort animal because people come in with dogs, cats, or rabbit, and we have a veterinary doctor on staff who takes care of them. And interesting, the animals actually do great. They have the best care they've ever had, and the people do. So some of our patients actually live longer than they were expected to in hospice. They time out at 6 months because they're eating 3 square, they're getting their substance abuse addressed, they're dealing with meaning in their lives, they're cooking for the rest of us. So they're gonna actually sometimes live a little bit longer. And before I leave this, I just want to point out, we all have people in our lives who are at this stage of life. How do we love and take care of them? How do we really listen to them in such a way that we're connecting, building trust, and that's a bridge that Christ can cross. Okay, that's a bridge. A lot of times if we're just thinking, I just got to come in and just blurt out my testimony or just give everything, get the gospel to them because that's what they need, peace with Christ, and we know that. Sometimes that abuses these folks because they need you to show that you trust them, that you can build trust with them first. You can sort of listen to where they're really at in terms of the tasks of dying, and we'll get into that in a moment. So joy, man. One more thing I want to say about this. So I have a brother who died of non-small cell carcinoma, a Christian guy, one of my brothers, my older brother. He called me one day when he was in treatment at home. He said, Ron, I'm out here on my front porch. I said, are you okay? He said, yeah.
Can you use the mic?
Oh, can you? Okay, sure. Now? Better?
Yeah.
So I'm talking about my brother in Chicago who called me one morning when he was in active care at home, palliative care for some non-small cell lung cancer. He said, I'm out on my front porch. I said, are you okay? He said, yeah. I'm looking at the tree at the corner of my porch. I said, what's wrong with the tree? Has it fallen in the storm? He said, no. It's covered in tiny little pieces of glass, like from ice. And there's a tornado of snow around it, and the sun is bright, and it just looks like the first tree in the world. I just want to call you. It's the most beautiful thing I've ever seen. People who are facing the end of their life, there are no throwaway people or moments for them. Everything's precious. Time has an expiration date, and so they start weighing everything that's happening to them in terms of what they know about the expiration date. It's precious to them. So when you're entering into that and building trust with them, it's important to realize there's a reason for this joy. They have faced the end of life, and they're surviving right now. They're moving ahead. They've got tasks to do at this point in life. The second surprise that I've experienced is that patients in palliative and hospice care actively value spiritual care in their life. Now, this is a surprise to some of us. We kind of feel like it might be a hard sell, particularly when about 60% of our patients, when I walk in the room and tell them my role there is a spiritual care volunteer, and I'm there to help them kind of work through all the issues they're dealing with that don't have to do with their medication. When they find out I'm a doctor, they want to know about their medication, so I go through all that too. But once we're done with that, so some people will immediately tell me, well, I'm not religious and I don't believe in God. So, that would shut down some of us in this room. That would have shut me down sometimes with the patients. But now that I know that there's a broader understanding of spirituality in our culture, it gives us a way in. I'll show you that in just a moment. But when they say that to me, I'm thinking to myself, great. So have you had anybody visit? Are you dealing with anybody in your family that your relationship should be better than it is? Is there someone you need to forgive? Oh yeah, there is. Are there any regrets? Oh man, have I got regrets. And how about meaning? Is this really dinging you now that you can't say get out like you used to get out and you're losing some of that contact? Oh really? Well, these are all spiritual things, okay? And so we need to talk about that. Which of these are you working on today? So it turns out that immediately putting me off and saying, what people are a lot of times saying is, I've not had much of a relationship with religious things, and I don't like religious people. But that doesn't mean they don't have spiritual tasks that they're working on. So spirituality, as it's defined by the American Association of Palliative Care, so I'll read you that definition. And this is going to give you an opportunity with these patients. So spirituality is defined as the aspect of humanity that refers to the way individuals seek and express meaning and purpose and the way they experience their connectedness to the moment, to self, to others, to nature, and to a deity or to a significant religious background. So, in our culture, we always put that at the end. But these are all the things that the patient is really working on at this point. When I said these patients are much more interested in spiritual care than we thought, a study published by the Journal of American Medical Association in the early 2000s polled patients looking at 44 different factors. They asked the patients and also their families about these factors, things like getting your finances finished, making sure family's present with you at the care center, having pain control, all these different things. What were the two top things that you wanted? And equally, in terms of two top things, might surprise this group. Number one was pain control. And number two was peace with God, including the ability to pray with someone. Okay? So you don't need to develop or create this need in your patients, they already have it. The problem is, among physicians, only about 7.5% of physicians or lower, that's 2024 data, are actually initiating conversations with their patients about spiritual things, and actually are even assessing their patients. There's a tool called FICA. You can Google it, F-I-C-A. It's a lovely tool. If you have an older patient or if even a younger patient who's facing an incurable disease. This is a great tool because it gives you standardized questions you can ask that will quickly show you where they are spiritually. Okay, the FICA tool, so feel free to download that. So we use that tool at our center to get a sense coming in the door, what their spiritual background, what their spiritual interest is. And it will cover all kinds of things about, like, is God important to you? Or do you have a community of faith? Or at the end of life, are there certain rituals you want us to make sure that we observe? All of those things are wonderful things to ask these patients, and asking is important. But doctors don't. Okay, doctors don't. 15% was the highest figure I saw. And the reason they don't is pretty easy to understand. The first one is that doctors may not see spiritual care. A holistic place like Grace House sees it as central to what they're doing. But they may not see spiritual care as anything but an add-on. It's really about medications and making sure symptoms are controlled and making sure that patients are, that we understand their disease process, and all of those are important. But it turns out that these patients have a high need for spiritual care type issues to be addressed, and you can't do that alone. And what are some of the tasks that we know these people are actually doing? Well, first task is they're trying to remember the meaning that they had in their life earlier, because now they've lost a few things. I've mentioned some of our patients are active and able to get out in the garden, but others are stuck in bed. So they can't, I remember a guy named Tony here just in the last few weeks. He was just seemed so, I said, Tony, he said, well, I can't get out and run, I can't get out and walk, and I'm not doing the things. He was a Christian brother, and he said, I'm just feel like I want to get outside. I said, let me put you in a wheelchair, let's go out and sit in the garden. So we do. And he said, out here I can just remember that God's got me, and I know him and he knows me, and we're having that great conversation. So people are struggling with that loss. Some of the tasks they have in this stage of life, they need to reconnect with meaning. They have to remember what's transcendent in their life. If they've never believed in God before, they're really scrambling to look for what could bring them meaning. They need to reconnect with people in their life, broken relationships or betrayals. They need to address using a life review. It's what we call the ability to think back to your great moments or hardest moments in life. And they need to address their regrets, and they need to address the great points in their life too. Some people, it's all about their next medication until we remind them, you know what, you had that road trip 2 years ago with your dad, it was amazing. And then the patients, that it really was. Let's look at pictures. So sometimes just helping that patient, they can't do it by themselves. Even your patient in your office that you're just seeing briefly for the medical issues, remember that there is spiritual distress going on. It's underneath the surface. Sometimes you can use a questionnaire, sometimes you just need to pray. Say, Lord, help me understand, there's something I'm missing about this patient. And you'll see that there's spiritual distress. So we need to help these patients. And unfortunately, physicians aren't great at that. It's other people doing it. It's the chaplain and somebody else coming in. But I would challenge this group. We are uniquely prepared to listen to people at this stage of life and understand. And it's a great question. Which of these tasks are you working on? Yeah. So we are uniquely prepared to be able to address these tasks with our patient. Okay. So another surprise, just moving on. We can only really connect with these patients if we have done some reflection. And again, this is very interesting. All my life I've written curriculum and using data and everything else, but here I am requiring myself to reflect. So reflection about your own expectations at the end of your life is important for you to connect with these patients, because you will not be able to even understand what their tasks are as a physician if you don't do that. And the second factor that's been shown in data is that if we are not performing self-care, you're not going to be able to connect with these patients. You're going to be so burned out in our modern healthcare system, you're going to be so used up that when you need a little bandwidth to connect with people, it'll almost be like incoming to you, and you'll keep it light, keep it surface. So if you really want to connect deeply with these patients, these are two things we need to think about. So we're going to do an actual reflective practice exercise right now. And at the end of this exercise, you will be able to connect more efficiently and effectively with your patients that you'll see this week who are at end of life, okay? So we're going to actually take a time travel trip together. So I'd like you to close your eyes for just a moment if you can. We're taking a time trip, and in this trip we're first going to go to the end of your life. Now, hang with me, you won't be depressed when we get back. And we'll be back in time for lunch, so everything's cool. So close your eyes for a minute, and I want you to imagine your life. For some of us, it may be, I don't know, sooner. For For some of us later, it may be 30 years, 50 years from now, some of us 10 years from now, whatever. But I want you to imagine yourself there. And the first thing I want to ask you, as you're there, I'll remind you that Moses said, remember, help us to teach us to number our days in Psalm 90. Teach us to number our days. Jesus himself, toward the end of his life, in his last 6 months in John 9, said, we must work while it's day, because the night comes. So when you get to this point in your life, you're starting to lose some of that connection with the old life you had before. Now, as you're thinking about that setting, it could be at home, it could be in a place like Grace House. Who's there? Are these the people close to you now? Are these the people that you love now? Who's there with you? Maybe someone you haven't met yet, they're there with you. Okay, think about who's in the room. And think about the relationships that you would like to have reconciled before you reach this last part of your life, even as a Christian. Think about the people you'd like to affirm. Man, you have been such a great person in my life. I don't want to leave out of here without telling you that. Think about the people that you want to bless. And now think about the arrangements you need to make sure that people you leave behind are comforted. You can open your eyes again as we continue on. You're still there. We haven't come back yet. We're still there. Think about all those things, and now you're actually getting close to the task these patients are doing while you're sitting there thinking about lunch and just there for a few minutes. They're actually working on all those tasks, trying to get those things done so that they can finish. And this is called a peaceful death. Now, before you discard that, realize peace with God is part of that. But a peaceful death includes these other things that I've mentioned to you. You have peace with God, but you have it in the context of relationships, the social encounters you have, all those things happening. So at this point in our lives, we remember that, we want to think of who is there with us. And now we want to center this experience we're having at the end of our lives and remembering that God is here with us as well. By the way, before I go on, Jesus did the same thing. I love that our captain never asked us to do anything that he didn't do, right? So he's up on the cross. I mean, he's in palliative care, guys. Very short experience. We've had people come in like this and they go right on to heaven. And so, they really love the Lord. So here's Jesus. He's saying to John and his mom, hey, you know what? John, you're the safe house for Mom. Mom, John, he's going to be the boy now. Okay? So you guys, we've got it. And what he was doing was arranging, and that's what I asked you, who do you want to arrange for their comfort when you're gone? And that's what Jesus was doing. He was paying attention to the people he loves. It's really cool. All right. So the next thing we need to do at this point, we're not back yet, is to affirm the preeminence of Christ in our lives. He made promises to you. He said, never will I leave you and forsake you, in Hebrews 13:5. I'm not going to leave you now. He said, my sheep hear my voice, they follow. And when I say come, you're coming. Okay? So he's there with you now. I walked into, and let's finish this experience, and I'll tell you the story. You want to affirm the preeminence of your experience with Jesus now, and you will. And then finally, you want to see your death in the context of Jesus' promise to you. He said, when anyone believes in me, go ahead. You die, I'll raise you up on the last day. I'll do it myself. I will raise you up, Jesus said on the last day. So Jesus has made promises to you, and this death that's happening, better to be absent from the body, present with the Lord. We have so much in the New Testament that reminds us of the context of what's happening to us, that here now at the end of our lives, in our thought experiment, we know Jesus is with us. We know we'll be able to say goodbye and leave this in his hands. Now I want you to come back to us. Let's go all the way back to 2025 now, all the way back to that conference room in the morning at Case Western, and bring back with you some of the feelings that you had as you went through this experience of reflecting just a little bit. Reflection's powerful. God often asks us to do this and reflect about this. So here we've reflected on our mortality. We've thought about the people that needed to be there. We've thought about what tasks we want to get done before we get over there. And then we also realize that when we arrive, Jesus is already there. He's got it. He's got this. I walked into Grace House one day a few weeks ago and was shocked to find a childhood friend of mine at Grace House. I'd lost touch with him. Bill had a leukemia. I didn't recognize him. I kept going out and checking the chart, coming back in and seeing, and then checking. And then his wife was there, and she said, Ron, this is Bill. So I went over to the bed, and he was just so withered from this leukemia, from his leukemia. His eyes were closed, and I said, Bill. And then he spoke to me. He said, Ron. And when I heard his voice, I realized he was completely the same guy. Nothing had changed at all. I could recognize him immediately. And I said, Bill, what are you doing here? He said, it's a long story. I'm glad you guys are here. But I want you to know something. I said, what? He said, God's got me. Jesus is here. Okay, and that really spoke to me. These people actually have the power to splash a little bit of truth and water on you and to remind you of who you are. It's not all flowing from you. Some of these guys will remind you the things you forgot in your busy workday. And so Bill reminded me, the Lord is here with me. So yeah, we get Christian people here as well. They fell down in a certain situation and unable to find a place to be, and here they are. And they've had every benefit of being around them to love them. And so we were singing some songs in his room. I'm thinking too of Steve, who's got an abdominal tumor that has now metastasized to the abdominal wall. But he's a recovered guy who loves the Lord, a Christian. His room is more like a bistro, really. When I go in there, there's food on the table, there's country music playing, there's like 15 people in there. And I'll ask the nurse, is this like a busy time? Oh yeah, he's got 15 people in there. So we'll go in there. And this guy is living his life filled with joy. He's an artist, so he's got this huge artist table, and he's painting birds and animals, and then he donates these to Grace House and their auction to support them. They said, this is great that I can continue to support, I found out that he's a fisherman, so we went out fishing for 6 hours recently, this fall, and here I'm seeing this guy can barely walk, clambering up and down the rocks to get in a good cast, down at the water. I was just amazed to see him in that environment. We caught a few fish, we're coming back, and he says, Ron, this is one of the best days of my life. One of the best days of my life. So there's all these ways that we are connecting, and we were mostly talking about the Lord and the goodness of the Lord for Steve, because he was just looking for the Lord in this whole situation. All right, let's see. I don't know whether I'm going forward or not. Is that the end of my slides? That's okay. All right. So what I want to leave us with here is that, when you're surprised, you're learning. If you're confused, you're learning. If you have patients that you struggle with to kind of connect with them, you're learning. That's all evidence of learning. Surprise, shock, that's an opportunity to learn. So sitting down with these patients and being present with them is so, so important. And how do we do that as Christians? Well, it's important for us to realize they are working those tasks. So it's always good to ask, which of these things are you working on? Are you working on your relationships? I'm thinking of Pat, who was a Christian woman, but she said, my family's a mess. I said, tell me about it. She said, well, they're on the way in here, and I haven't seen them in 20 years. I said, really? And she said, would you talk to them before they come in? Because I'm good, but they are so hard on each other. They're going to be arguing. They're going to be fighting. So I met with them out in the lobby, and I said, Pat's good. She's ready to go home to be with the Lord, but she's worried about you guys. She says there's a lot of conflict in the family, and they said, yeah. And I said, well, listen, this stops now. It's time to forgive each other. Jesus said, and I went ahead and explained, what Jesus said. It's time to forgive each other. And I don't want you going in there to try to comfort her and bringing all of this. So it's time for you to pick one thing that you've done to anybody else in the room and ask them to forgive you. They all looked real sheepishly. I left, I came back. 10 minutes later, they're all sobbing. So we're in there praying together about how good God is and talking about how they could begin their own life with Christ. By the time they came in to see Pat, she was crying. And it wasn't like everything was done, but it was the beginning enough. 3 days later, she passed away. She was able to see the beginning of that kingdom spreading through her family. And God brought them all there in this very severe situation to initiate their spiritual life. One of the things we want to remember is that my last, this just, sometimes doesn't, I don't know why. My last surprise was that conversations with people will not be what you thought in palliative care. You thought, we're just going to talk about the gospel, and you'll get there. But there are going to be other things. One guy that I watched Wicked Tuna with, like by the hour, I just said, so what do you want to do? But I said, why do you watch this? He said, it just takes me to other places. He said, so this is a hard place. And now we're having that great conversation, that right conversation. Another patient, I walked in, I said, I'm the spiritual support for you here. And we can pray together. Well, he said, I don't really pray. I said, okay. He said, I just believe when they put you in the ground, you're done. That's all there is. I said, okay. But then he started railing on all the Christians he'd met his entire life. And every time we met, he would rail on the Christians. He said, after a couple of times I said, I have to make the observation that you've really had a lot of problem with some of the Christians, that you see those inconsistencies in their life, and they're there. But I said, I wonder, do you have the same problem with God? We always talk about the people. What about God? And that was a different conversation. Lastly, I want to tell you about Cecil. So Cecil was a 79-year-old man that I was covering for. I came in. He actually had been he was over at the hospital now getting treatment because his blood count had dropped so low, and then he was going to come back. So I go to see Cecil, and I said, hey, Dr. Jones, I just wanted to drop by and see how things are going. Not good. I said, is anybody visiting you? He said, no one will come from my family. I said, why not? He said, I've been really hard on my family. I said, really? Your wife won't come in? No, she won't come in at all. I'll be here by myself. I said, that's awful. He said, I don't even think God would forgive me. Now, when I hear things like that, whenever I hear someone say something that's at variance with the gospel, like their God would not be the God of the Bible or whatever, I always stop there and say, would you mind if I gave you a different perspective? And I like to ask permission, because I'm not really proselytizing, I'm sharing another viewpoint based on a living faith with Christ. And so he said, no, not at all. I said, Jesus came an awful long way to forgive you and me. He went to a lot of trouble to do it. I believe he could forgive anyone, and if you were forgiven, then you could start working on these relationships. I told him how he could just ask God, hey, forgive me, I'm sorry. And it's just based on what Jesus did. I said, oh my gosh, I'm late. I got to get out of here. We'll talk. So I left and went on to see other patients. That night, overnight, his condition worsened and he expired. So on Monday afternoon, I met with Cecil's family. Often happens, in this setting. And I met with them. And she said, Dr. Jones, would you mind telling me what you and Cecil talked about at the hospital? And I said, sure. And I related that conversation to her. She said, well, I'm a Christian. She said, he called me at 8 o'clock on Friday night. And he said, God has forgiven me. Could you ever find it in your heart to forgive me? She said, honey, I've been asking God for us to have this conversation for 25 years. And he broke down and started crying. She cried. They were reconciled. And off to glory he went. She said, this one conversation with you has given my entire family comfort that we will see Cecil again. So we need to realize these conversations will not be what we thought they would look like, but they are ways in where the gospel will actually easily run across that bridge. Palliative care programs don't treat people. People treat people. So when you come in the room, you think, I don't know what to do for this new patient. I feel this way every time. I don't really know them at all. I've read a little bit about whatever, and we've had a brief conversation. I'm just going to sit here. Is there anything I can do today? Let's just talk about how meaning is going in your life and how relationships, and we get down that road. I'm actually sitting there and I'm asking the Lord, show me what you're doing in this guy's life or this girl's life. Jesus said, my Father's working and I too am working. I love that in John 5:17. And so as Christian physicians, we're in sync with that. And if you don't know what else to do, remember that you brought the fruit of the Spirit with you into that room when you came in. Love that doesn't need anyone to do anything for you. You're able to give it freely and without judgment. How about that? Even a person that you might love, you can just love them unconditionally. Or you might judge them, but you're not going to do it because you've got that fruit of the Spirit. Joy that has no end to it, coming out of your heart. A little joy. And these people love a flower, a conversation, laughter, a little humor, sardonic wit. They're going to need that little bit of joy. And you can go through each of the fruit of the Spirit, the peace that you have. People can sense it. I'll say, well, I have to go now. I'm sorry. Why? I just feel so peaceful when you're here. It's not me. It's the fruit of the Spirit that is living in our lives that these folks can latch onto. You can have the same fruit in your life, and we have that conversation. Now, can I do this in a secular environment? Absolutely, all day long. For one reason, Grace House is centered in spiritual care. They have priests and rabbis and everybody else, and the doctor come in and do spiritual care. But the point is, yes, because they invited. And you can do this in secular settings because you ask permission. And because you recognize the spiritual distress in a patient, and you realize, if you don't get that right, guys, then you really can't address the real issue. It may not be pain for this patient. You already given pain medicine. There's no physiologic evidence for pain. I'm thinking of William, one of my patients. And the nurse just kept ratcheting up his pain medicine. It wasn't doing it. The spiritual volunteer found out that he was estranged from his daughter, who he neglected until she was 10 years old. When she moved out as an adult, she had nothing to do with him. And he's upset partly because he can't reconcile and she won't have anything to do with him, and partly because he thinks God wouldn't forgive him. Of course, we turn to the scripture, and when he was able to see that God could forgive him, his pain needs completely modified. And that's an important thing for us to realize. Spiritual distress modifies all these other things. So if you're going to be holding an end of life discussion, giving bad news, all those things, it's important for us to understand those patients have tasks to fulfill. Later today, we have talks on wellness. Wellness was a huge part of my last 5 years of career, in which we developed an aggressive wellness strategy, including a validated tool that runs on your phone, a psychology group that's focused on people who are in academic settings, losing patients in the ICU and really need to be revived after that experience. And that was a great addition in the health system. But now all of us, need to find ways to recover. Every time your patient dies or loses something, you do too. Yeah. So you need to pray for them, and you need to pray for you. You need to celebrate them, but you need to celebrate yourself too, and take care of yourself. We'll learn more about that later today in another session. I'll bring my comments to an end, and any questions you might have, go right ahead, Phil.
Yeah, so I was thinking about palliative care. Most of us won't be involved in that directly. What can we, at this point of our lives, whether we're students, whether we're active physicians in the community, what are things we can do to kind of prime the pump so that, in a sense, through interactions with us, when they get to that point or at the end of life, you know, we have set them up well for that. What
Well,
do we do?
some of that's a great question. So the question was, what can we do to sort of prime the pump for having those conversations later on in life? Some of that I've learned actually from people in this room. Okay, I know Mike, and I think John Schaefer here, others in the room have done a spiritual survey on their patients as part of their regular intake. And even if you don't use a survey tool, you can ask patients. It's important in my practice. I believe spiritual care is important. When you think about the things giving you life and meaning, is God a part of that? Are you really adding into that? Because it will affect how I treat you and how we talk about these issues in the future. And patients are very forthcoming, and we'll actually talk about that with you. So it's good to let them know you think that's important earlier in life, even if they're not dying. Yeah, Joe.
Yeah, more of a comment on that.
Sure.
So when we look at palliative care, right, we're having our final loss. So as an orthopedic,
Having our
final loss.
Our final loss.
Of our lives.
That's right.
So as an orthopedic surgeon, I have a lot of people who they might be losing their sport. They might be losing a certain aspect of their job. So in essence, I would say it actually transcends this discussion. Transcends much of our professions out there in our many varieties, because everybody is experiencing loss.
Right.
So there's always how do we bring the God piece to bear?
Yeah.
So all of this I would say is absolutely applicable in a smaller way into every profession that we do.
So it's important to realize these people long for someone to have that conversation. Most of them do, but they don't know how to address spiritual needs. So that's so important for us to be ready to be able to address these needs with them.
Yeah,
Follow up?
Yeah, just to finish that up. So that's obviously, I think we're going to be talking about anxiety, resilient physicians, and things like that. So our systems as they are now don't necessarily give us the time to allow us to actually focus on what we need to focus on. Which is why I'm independent.
Yeah.
And that's why I promote independent physicians for those reasons.
Yeah, it's a really good point. One of the barriers is a lack of time. You're being pressured through, and how can you really listen to someone well? Richard, question?
Yeah, I was kind of curious about if you've encountered patients or folks who have been, so kind of down and out towards the end of life, where they're, interested in something like euthanasia or interested in something like that sort of course of action.
Right. So are people because of the place they're in life experiencing just hopelessness to the point where they're asking for euthanasia? So it's good that you bring this up. We see depression at about a big range, between 25 and 77%. That's pretty high incidence in people who have an end-of-life diagnosis. And it gets worse as they move toward their terminal care. So we'll deal with those things. We'll deal with suicidal ideation sometimes. What we found is that when we offer people control of their pain and begin to address depression, which often can compete with other underlying diagnoses and comorbidities, so we have to winnow that out. Is this depression, or is this your underlying leukemia and all the chemo you have? And we find out, no, they're really depressed. They were depressed 30 years ago, and this is in the family, and here they are again. So we need to treat that, and we can treat their depression. We find, though, that that conversation drifts away when they have their symptoms managed and when they're in a place where they're loved and accepted at that moment. I know that sounds like a real happy answer, but that's really, the literature shows that too. It's in places where there are limited services, people are being forced toward, hospice, that people feel hopeless like that and want to end their life early. Other comments or questions? I know we're into your rest time or your break time, but yeah, back here.
Yeah, I see the value of what you're saying. It's, Jesus was a man of sorrows, acquainted with grief. Paul said, as sorrowful yet always rejoicing. How do you work with sorrow?
Yeah. Well, I love that. And since you mentioned Jesus, that's, our captain has been down this road with people, right? And so he has that experience. Even though he was a man of sorrows, he said, I want my joy to be in you. In other words, coexisting at the same moment as the reality of sorrows and loss, joy can live in that same moment. And Jesus was also filled with joy. Two things that were happening at the same time. You could say that while he was weeping, over Lazarus and over what had happened from death, in that moment he was overtaken. But a lot of the time he was also drawing from this deep well. So back to loss. First, we recognize the loss. I mean, we just say to them, man, this is awful. I mean, you can't get out and golf anymore. You can't go walking anymore. These are things that brought you great joy. And here you are. How are you doing with that today? What can you do? And so first we affirm people's losses and we live with them in that moment. We stop there and we experience it together. And then when the time is right, we look for things that would bring a different focus. So I think this is called reframing. So we would basically affirm the loss. Don't tell people they're not losing. This is awful. But what can you do? And you'll find people often will pivot and will be telling a joke and moving on with what they can do, and we focus on that. That's a little bit of an answer. Another question? Back here. Yeah.
Yeah, it's not so much a question, but
Comment.
just wanted to say thank you for what you've shared. I'm a hospital chaplain, so work on a lot of different levels within my hospital, and so it just helps to reaffirm
Yes.
the depth and the quality of care,
Yeah.
not just for patients at the end of life, but while they're patients in the hospital.
Yeah.
And patients one thing, family, loved ones are another, but not just those. Also, the system, the hospital system,
Right.
physicians who don't care as much about spiritual care, those that do, but also from a system level, trying to integrate the need for spiritual. There's so much data out there,
Right.
where
Right.
spirituality
Right.
and healthcare impacts the well-being of the patient care and the outcomes. So just thank you.
Well, you're so welcome, and I'm going to back at you because if we could clone you, but we can't, okay? If we could have you everywhere, palliative care teams are calling for every member of the team, nurse, doctors, anybody who's visiting the patient to be trained in spiritual care. They're calling for that because it's so critical. Spiritual distress is so completely, you go ahead and Google it. If you find anything above 15% that it's ever offered, it's low. And so we know these patients need, so they want every member of the team, including all of us, to be trained with how to do some, we can't be chaplains, but we can do some spiritual care. And that's how we take care of these folks. So, all right, I'll end my comments here. We'll have more questions later. Thank you.